Welcome to this presentation about acute neck pain, that's pain that's been around less than 6 weeks, and subacute neck pain that's been around for 6 to 12 weeks. This has been created by physiotherapists working in the Swansea Bay Health Board. By clicking on this link, you are probably looking for ways to help your neck pain. If so, you are in the right place. Neck pain is a very common condition which most people will experience during their lifetime. This means that many people you will know will have had neck pain at some point, and many of these will want to discuss their experiences and recommendations with you. In addition, there are many healthcare professionals who recommend different treatments and who practice in different ways. This can sometimes be conflicting, confusing, and frustrating. Fortunately, there is a body of scientific literature available to help us make good choices about our healthcare. The National Institute for Clinical Excellence, or NICE for short, regularly scour the worldwide scientific literature and make recommendations based on this. In the NICE guidelines for neck pain, they make several recommendations for treatment of acute and subacute neck pain. This presentation aims to clarify some of this information to help you make some informed choices about how to manage your neck pain. We will deal specifically with two areas of treatment which are recommended by the NICE guidelines: education and exercise. So before I start getting into it, here's a little bit of what to expect. We'll start with looking at some of the common myths, scare stories and misconceptions about neck pain. There are quite a few. It might be very reassuring to hear some of the things we know about neck pain, facts and not fiction, and why this changes some commonly held beliefs such as always rest when it hurts and my discs are crumbling. We'll also talk about why we hurt sometimes and how an effective pain system can help you survive and why our pain system doesn't always work well for all of us. Finally, we'll use what we know to offer advice and practical planning, thinking and exercise strategies to help move, cope and live better with neck pain. Acute neck pain can be defined as pain in your neck somewhere between the base of your head and shoulders. Pain can vary from mild discomfort that has little impact on your life or to severe debilitating pain or spasm. It's not uncommon for pain to move around and can radiate into the top of the shoulders and arms. The cause of your neck pain may be an awkward or sudden movement, strenuous activity, repetitive task, or lack of movement. This can lead to an injury or irritation of different structures in the neck, those being discs, muscles, ligaments, or joints. However, it is often difficult to attribute neck pain to a specific structure, so you may hear your neck pain being called non-specific. Other names you may have heard acute neck pain being referred to as is muscle spasm, whiplash, wear and tear. But really, in the acute stage, we treat all these conditions in a very similar way. Neck pain can present in different ways. Sometimes you might feel it in your neck, the base of your skull, or your shoulders. Your neck movements may feel stiff and restricted and can sometimes be painful. In some cases, pain can travel down the arm as far as the fingers, and some people might experience pins and needles and numbness down their arms into their hands and fingers. The neck, like many parts of our body, is quite complex, and really that's what makes it so fantastic at doing its role. There are 7 bones that form the neck, called the cervical vertebrae, and they're numbered from 1 to 7. They help to support the head and protect the spinal cord. They're linked together by facet joints, which then connected with all the neck muscles, and this allows you to move your head in all sorts of different directions. Our necks have a lot of movement. They can move up and down, left and right, and rotate left and right. Often we combine these movements. For example, we look behind us in a queue at what a person has dropped on the floor, so therefore we're rotating and flexing. Between these bones are discs of cartilage known as intervertebral discs. At the level of each disc, nerve roots branch out from the spinal cords. Impulses travel along these nerves, sending sensations such as touch and pain to the brain. Here are 3 common facts to reassure people. Neck pain is pretty common among the population. Most neck pain tends to get better on its own, and gently keeping your neck moving is important to prevent it from getting stiff. My neck is worn out is something that we hear quite often, but research does not support the widespread belief that getting older causes worsening neck pain. Think of a pain-free part of your body. It's the same age as your neck. Neck pain can be severe and can be very scary, but it's rarely dangerous. Part of a good clinical examination is to ensure there's no serious pathology. A health professional might ask you questions around dizziness, problem speaking, problem swallowing, and pins and needles in your arms and hands. They might also ask you about things like losing weight or health issues, recent trauma, and so on. This may affect their decision on what to do next, but they always make sure you are safe before proceeding to treatment. A healthcare professional can then guide you what to do next. Reassuringly, only 1 to 2% of neck pain is from a serious pathology. A lot of people think a scan will show what's wrong. Although in some situations a small number of people will need a scan, they cannot be trusted to show the cause of neck pain in everybody. Scan reports can sound scary. Findings like disc bulges, protrusions, degeneration, and arthritic changes are very common. Amazingly, these are equally common in people who do not have neck pain. Therefore, a scan cannot predict the amount of pain you have, or where it comes from, or how you should treat it. Age-related changes happen to the joints just as they happen to the skin and hair. Just as we can tell a person's age from looking at them, scans reflect these normal changes to our body, like wrinkles, but on the inside. Posture is often blamed for neck pain, leading people to try and hold themselves upright all of the time. Neck pain is not caused by poor posture. It is safe to relax and change positions during everyday activities like bending, lifting, and sitting. Your neck would have evolved to be a plank if being held in one correct position was the best way forward. In fact, we've evolved to bend, lift, twist, and curve, as well as stand up straight. Moving like this often and in a variety of ways is nearly always healthier than maintaining a straight neck for prolonged periods of time. Never forget that all pain is real. It's a personal experience and cannot be compared to someone else's. All of our pain is produced by our brain. So if neck pain isn't about bad posture, changes in your joints on an MRI, what is it? If it doesn't indicate damage, then why does it hurt? In a word, pain is there for one reason alone, and that is protection. When you put your hand onto a hot stove, you need your pain system to work quickly to make you change your behavior. Pain stimulates all sorts of helpful responses. You snatch your hand away, preventing further burning. You shout out loudly, letting other people know there is danger and that you are hurt. You run your hand quickly under the cold taps, and perhaps most importantly, you don't do it again. You have learned that something is bad for you through pain systems detecting thermal changes in the receptors in your skin. Your pain recognizing that this is a threat to your health and causing you to react in all those helpful ways. This is why pain can be useful. However, there is not always damage to our bodies when the pain system kicks in, merely a need to protect us. Take an example of a stubbed toe. Toes are small bones necessary for walking and balance, yet are in vulnerable positions right on the end of our feet without many layers of strong muscles to protect them. Our pain system, however, is strongly wired to help out with our protection. On stubbing a toe, we shout and hop and sometimes cry and swear and hold the toe. But very soon after, the pain goes away without a mark on the skin. Although there is no damage, there is undisputably a lot of pain. Thank your pain for protecting our toes. We are more careful next time we walk past that brick on the floor and make sure we don't stub it again. In the majority of cases, hurt does not always equal harm. As alarm systems aren't always 100% reliable, they can be oversensitive. For example, if you overstretch your finger, it might hurt, but it doesn't mean that any harm has actually come to it. All pain is real, but it's not always because there is damage to the tissue. Sometimes it's just alarming you about something that you did. Pain is complex, and quite often it can change our thoughts, behaviours, sensations, and emotions. For example, if we think that our neck is damaged and it can't work or move, we then can become frustrated, angry, and low in mood and worry a lot about our neck. Then, because of that, we avoid moving the neck, and then we become more isolated because we can't move it. And then, because we have a pain, ache, or tingling sensation, we worry more, and then this cycle of thoughts, emotions, behavior, and sensation can lead to our pain alarm system becoming oversensitive. So, when experiencing pain, what are our best options? Regular exercise helps to keep you and your neck fit and healthy. If you're experiencing pain, it can make it harder than usual for you to go about your daily activities, but it is important to maintain your level of activity as this can help you get better sooner. You may have to take things a little easier at first and gradually build up your activity levels over a few days or weeks, but it's important to realize that pain doesn't always mean damage. Remember to allow time in your day to do activities or exercises that you enjoy. This will help benefit your recovery. A good rule to remember is changing your position every 20 minutes can be used to help manage your pain. Think about what postures make your pain better and use this to your advantage. There is not one size fits all perfect posture. So what about using pain relief? We recommend you always use it as directed. You can speak to your GP or pharmacist for advice about pain relief. Painkillers can sometimes be useful because they give you a little bit less pain and that allows you to keep moving. We do not recommend the use of painkillers for long term unless you've been advised from a medical professional. Keeping positive is really important when you have neck pain. It's normal to worry about pain, but some studies have shown that people with a positive mindset are more likely to improve. Anxiety and unhelpful thoughts are often barriers to improvement because they give us a lower mood, they make us stress and worry about the exercises we are doing, and therefore we do less. Successful recovery targets on all the different dimensions of pain. We always recommend people to try and stay in work where possible. It tends to give a better outcome because you will lose focus on your pain at some times in the day by doing your normal work. Always ask your employer for help if you need it. There may be adjustments that they can make. Modify your workload, and you may need to reduce your workload temporarily, but sometimes it doesn't mean giving up work altogether. Gradually build your workload up as your neck symptoms start to settle. When a neck is very sore, starting with the simple movements first can be a good way to get into exercises that will help your neck. Think about moving your neck up and down, left and right, rotating it left and right, and trying to do a neck stretch where you slide your chin forwards and backwards to give yourself a double chin. Strength exercises are really important in neck pain. Consider putting your hand behind your head and pushing back into it for 10 seconds. Do the same with when you push your head left and right and rotate it, as well as tucking your chin and your shoulders back. These exercises are some progressions on the previous exercises we did for your neck, involving some upper body strength that will take some neck strength as well, such as a press up on a wall or a press up on your knees on the floor, a rowing action, which you could use a band or a can of beans, pulling them from in front of you towards your side, like in the middle picture, and some exercises in 4-point kneeling when you arch and lower your back and weight bear through your arms. Other upper body exercises can be good to do while your neck is progressing, things like bicep curls and tricep curls or press work. The treatment methods listed on this slide are commonly used by people. However, there is insufficient research evidence to support the use of these following treatments in acute or subacute neck pain. Some patients, however, will experience some temporary pain relief from these treatments, but the reason for this is poorly understood. The following slides contain a lot of information about what you should do if your symptoms aren't improving. Please read them carefully. There are some slides that suggest when you should see a physio, your GP, or in rare occasions attend an A&E department. Please take your time to read through all these different bits of information. Thank you for listening to this webinar. We hope you found it useful. We have put some links here on this last slide to show you some other places you can get information. And on this webpage, you will find ideas about the exercises and activities that we have included in this presentation. Thank you for listening.